Welcome to our show Health and Wellness Myths and Facts. I'm Ambika Singh Kama. The term heart disease refers to different types of heart conditions. While most of these conditions are preventable, heart disease is the leading cause of death in both men and women globally. Indians develop heart disease 10 years earlier than those in Western countries, and nearly 3 million individuals die from stroke and heart attack each year. The most worrying part is that among the heart attacks, 40% are below the age of 55. In young Indians, higher rates of heart disease are due to both inherited genes and environmental factors. Unfortunately, these environmental factors have only worsened the risk over time. Stressful jobs and working long hours have become the new norm in our lives. Even a lack of physical activity and eating a lot of processed foods have contributed to increased heart disease risk. The COVID pandemic has exacerbated the cardiovascular disease burden. When people are informed about the risk factors, they can take precautions or manage their symptoms at the earliest and reduce the risk of a heart attack, heart failure, stroke or sudden cardiac arrest. We have experts with us to give us correct guidance about heart disease prevention and management. So if you have any questions you would like to ask them, please send them to us via WhatsApp. The number is +91 9167 666 941. Yes, that's the number to send us your questions. Do also please send in your name and your location. Let me introduce our panel. We have with us Dr. Praveen Chandra, Chairman, Interventional and Structural Heart Cardiology, Interventional Cardiology, Medanta, the Medicity, Gurgaon. Dr. Jagdish S. Hiremat, Chief Cardiologist, Heart Transplant Program, Ruby Hall Clinic, Chair Professor, Preventive Cardiology, MUHS, Pune, and Dr. A Sharath Reddy, MD, DM, FSCAI, FACC, FAHA Director, Complex Coronary Interventions Director, TAVR, and Structural Heart Diseases Director, Cath Labs, Senior Interventional Cardiologist, Medicover Hospital, Hyderabad. Thank you all so much, doctors, for joining us today. Starting with you first, Dr. Chandra, we know about, that the COVID booster is critical and it helps boost the vaccine's effectiveness. But can people who've recently undergone a cardiac surgery or even an angioplasty, can they receive the booster shots? Do you recommend it?
Okay, so this is a very common question as you asked that, whether they can get a COVID vaccination or a booster shot. So the answer is most of them can actually have it. And what happens is that those people who have angioplasty done in the past or who are just taking heart medications or who have undergone a bypass surgery, they are absolutely okay to get the vaccination. The only little thing is that in case they have done it really recently, they are recovering from the recent angioplasty or a bypass surgery, they can wait for maybe 2 weeks or 10 days or something like that. And once they are up and about, they can get this vaccination done. And the second is that many times those people who are just on medicines, they are not taking the vaccination or the booster shot because they have a heart disease and they are on medicines which are blood thinning medications. They also can take the vaccination without any problems.
Okay, no, thank you for explaining that. In fact, okay, Dr. Reddy, what are female specific disorders that increase a woman's risk of heart disease? Because we see that increasing as well. Do younger, physically fit women also need to worry about heart disease?
Yeah. See, women are naturally protected by their hormonal balance before menopause.
Okay.
So incidence of heart disease is quite low before menopause in women when compared to men. But after menopause, as the hormonal protection is gone, so the incidence is almost same. But we do see women coming with heart attacks these days for various reasons, mainly because of the lifestyle. So obesity is increasing, and next is because of smoking and drug addiction. So these are the reasons, because of which they can lose the protection they had by nature. And also there are certain specific disorders like dissection of coronaries. So which can happen especially in pregnancy or postpartum phase. So where the inner layer of artery gets separated from the vessel wall and occludes the artery. So this is something which is specific and and happens commonly in women. And another thing is like family history. If there is any family history of coronary artery disease, that also increases their risk of having coronary artery disease.
Okay. Yeah. So Dr. Chandra, like Dr. Reddy did tell us, women are protected till menopause. So tell us, are women at less risk for heart disease compared to men? When do women actually, when are they really at a risk of having a heart disease and stroke? Is it only after menopause?
Okay. So this is again, a very good question, I must say, because it really involves the health of women. And today we are very concerned because earlier everybody thought that women will not have a heart disease.
Absolutely.
And in fact, in our hospitals, about 80% of the angioplasty which was done to men, and only it was less than 20%. But increasingly they are coming up. And as Dr. Reddy already mentioned, what are the reasons for that? But let me tell you, those women who have surpassed the menopausal age, they become equally exposed to develop a heart disease. And many times, even before menopause, we have started seeing heart patients in women. And that is also because of factors like diabetes. If a woman is diabetic, if she is high blood pressure patient, or is she having a family history of heart disease and high cholesterol levels, then there is a chance that she can develop a heart problem even if she is still menstruating, which means before menopause. And the protection effect of the hormones does not remain as good in these women. So if somebody is having any of these risk factors, they should be very careful in maintaining a good lifestyle, in getting medications for diabetes, controlling high blood pressure, because many times I have seen that in women don't take care of the blood pressure. They think that it is just okay to carry on like that, and they don't take medications for high blood pressure. And one of the commonest myths which people have is that if I start taking medicine now, I'll have to take it for lifelong or for a long time. But the problem is, if you don't take medicines, you are exposing the body to develop heart disease, kidney failure, and also sometimes even stroke. So my advice is that we should take care of it from the very early stages.
Absolutely, so that there are no further complications. Dr. Reddy, now we've understood about women and heart. To tell us, what should a person, if he or she experiences symptoms of a heart attack, and is it possible for people to help themselves in this condition or a situation where they feel they are actually going through a heart attack?
Yeah. So when a person should understand he had a heart attack. See, I'll give you a couple of things which everyone should aware of. If any person is developing chest pain first time in his life, it is always better go and consult rather than concluding himself as a benign problem. So that is the biggest thing which we are seeing. And sometimes these initial episodes are like warning signs. If a patient get consultation, and he can be saved by further procedures. So any patient who gets chest pain first time in his life, so better go and consult. And next thing which everyone should know is, if someone has chest pain along with sweatings or vomiting sensation and pain lasting more than 10 minutes. So this is another situation. So chest pain more than 10 minutes associated with sweating, unless ruled out, it is heart-related problem. So any person having this kind of symptom, again, they have to reach emergency department as early as possible. So how to reach? If there is any, if there are onlookers, it's always better, take the help of those onlookers. And it's always better, when patient had this symptom, there shouldn't be any exertion on patient body, because any exertion increases oxygen demand of heart muscle and increases effect of the stroke. Sometimes, they may end up in cardiac arrest. So that's the reason patient has to rest. And it is good. People around can take him, sitting, making him sit in a chair, transport to, the vehicle, and then to the emergency department. If drugs like aspirin or sorbitrate are available there, so we can give and transport him to hospital. If they are not available, the best thing is reach to emergency department, closest emergency department, as early as possible.
Okay,
So that is the best thing a person can do.
Yes, I think that's really well explained. Moving on, Dr. Chandra, we've been talking about the symptoms, what to do in case of a heart attack. But heart disease is still the leading cause of death for both men and women. But it presents and develops differently depending on gender. We have spoken about menopause and how a woman should take care. But just in brief, just going back to that, what are these differences, and do the risk factors also differ in both genders?
I mean, as I already mentioned, that there is a gender difference in terms of how much the disease affects and how many people are affected. Definitely, there is a bias towards men getting more heart disease than women. So women have that protection. But as I said, that it is not essential that every woman should feel that she is absolutely immune to having heart disease. So the risk factors, like, as we were discussing, if somebody is not exercising enough or being active or is getting obese, then in that situation, the chance of having disease becomes higher. And of course, smoking is also one of the risk factors, as you already know. And now, definitely there is a change which is happening in society sometimes, and you can see at public places the smoking has come down, but it still has to, in India, it has to come down, and women also must refrain from smoking. So that is something which I definitely advise. So because that gives away the protection, the hormonal protection which women have actually goes when any of these risk factors creep inside the body. Okay. So that is one very important thing, and definitely after the age of 50 years, it becomes very important to take care of oneself by going for regular physical activity, at least 45 minutes, at least 4 to 5 days a week. Okay. And also diet control, which means that you can eat everything but in balance. Yes. That is the very important.
I think again key here is a healthy lifestyle, taking care of yourself, and like what you rightly said, for women especially, I mean, not to take it lightly, and post 50 I think take extra care. So on that note, we're going to be taking a really short break. We'll be right back. Welcome back. Dr. Hiramat, we've spoken about symptoms, we've spoken about what we could do, but many people do assume that heart disease is preventable and caused by a poor lifestyle. So slim and active people are protected. Tell us what really is the fact.
Yeah, it is a lifestyle disease mostly. I think if we take 100 heart attacks, I think I would say almost 80 are because of a bad lifestyle. The genetic factor which comes in is in the form of strong family history in the first degree relative, or it could be a high cholesterol propensity which is transmitted by genes to the next generation. But the remaining 80, I would say, are because of lack of activity, diabetes, overweight, and smoking and other addictions. So it is a lifestyle disease majorly, and it can be prevented by a very good lifestyle. There is no doubt about it.
Okay, so a person, if they are slim, do they need to take, I mean, can they be more like, can they relax at saying that, no, we are okay, I mean, we are safer? So is obesity, no. I mean, what is that? Because there's a lot of confusion on this.
Not at all. Actually, a slim person just by way of weight may be safer, but he could have other risk factors like hypertension, he could be a smoker, he could be a diabetic. So all the factors like weight, blood pressure, sugar, cholesterol, all of them need to be exactly on targets to be safe.
Okay. So, I mean, one should not avoid any sort of symptoms even if you're slim. Dr. Chandra, thank you. Dr. Chandra, who is the right candidate for, angioplasty, and who needs a bypass surgery? So, could a bypass surgery be a better option?
Okay. So, that's a very interesting question, very important, because when people get affected by heart disease, the commonest symptom is angina, which is chest pain, which is happening initially on exertion, and then on increasing exertional activities they develop chest pain, and sometimes even at rest. And at that stage, these patients are advised to undergo tests like stress test and angiography test. And when we find blockages in the heart arteries by angiography, then based on the angiographic report, based on the patient's condition, based on the patient's age, and his physical condition, we make a decision whether he goes for angioplasty, which is putting stents, or bypass surgery. But broadly speaking, I can tell you, those patients who have multiple blockages and long blockages, in these patients, when all the three arteries are involved, bypass surgery is a better way to treat these problems because the chance of reblockage is much lesser. Okay. But in those patients where the blockage is in either one artery or two arteries, and it is in a very small, length of the arteries, in these patients, we do angioplasty and put stents. And these days, stents have really shown very good results over a long-term period also.
So a lot, like you rightly said, a lot depends really on the blockages, and then you all decide. Okay, Dr. Hiremat, what are the signs and symptoms a patient should be aware of post-angioplasty, and what to do in case of an emergency? How does one deal with it?
I would like to divide this into almost 3 periods, like 1 month after the angioplasty. Something can go wrong with the stent. That means there could be a clot inside the stent. And the symptoms are usually very alarming: chest pain, sweating, and all the symptoms suggestive of a heart attack can come in the first 1 month. There could be bleeding because these people are on very high blood thinners, and they can get bleeding under the skin or in the stomach, or it can come out through the rectum or other things. So the symptoms related to chest pain, any grayness or blackout in front of the eyes, shortness of breath should be immediately reported to the main doctor or his team or her team for that matter. And after 1 month, things become a little easier when this kind of a life-threatening emergency most of the time doesn't occur. It could be slower symptoms like getting discomfort after exertion can come back. After 1 year, actually, then the symptoms are related to, again, exertional symptoms. So any emergency should be reported immediately, especially within the first 1 month.
Okay. So nothing should be like, put aside. Any sort of symptom, it should be reported. Dr. Reddy, now tell us, what is the role of cardiac rehabilitation post-angioplasty or a bypass surgery? And does home cardiac rehabilitation, does that work? Is that really possible?
Yeah. So cardiac rehab is the most important in patients who are already diagnosed with the problem and underwent a procedure like angioplasty or bypass. Because in these patients, prevention of problem is the key. The secondary prevention is the key. See, we shouldn't allow the patient to end up in again the same problem. So for this rehab program is very useful. And also, this rehab program we can divide into 2. So one, for patients who had a heart attack and then had a procedure. So in these patients, when they had heart pumping dysfunction, so generally for first 2 to 6 weeks, so cardiac rehab therapist will keep them in a very low physical activity, because that's a time which takes for heart muscle to heal. So after heart muscle heals, they can start doing whatever physical activity they can possibly do. So if they do more physical activity during this time, so that may lead to a adverse remodeling of heart, which reduces pumping function further.
Okay.
So, and also later on, in a secondary prevention stage, so these patients will be given an incremental escalation of physical activity, which they can tolerate, and this physical activity gives them a good functional capacity, as well as affects glycemic sugar control and lipid control in a better way.
Okay.
So reducing their chances of having another heart attack in future.
Okay. Okay. Now, thank you for explaining that really well. Dr. Chandra, we know stress is a huge challenge now. So tell us, what are the ways in which the heart is stressed, and what practices do you suggest to de-stress oneself?
Okay. Yeah. So stress is a very, very important factor, I must say. And it has been increasingly recognized that both mental stress and sometimes extreme physical stress can also give rise to this. So extreme means like, if somebody is really doing a marathon run or something like that, and we have heard that people have developed problems after a long run or severe physical exertion, which is not done in a person who is not practicing his exercises on a daily basis. So that is why I say that one should only go on a very gradual basis on doing physical activities, because we have heard that people have gone to gym and suddenly started doing extreme physical exertion and developed some heart problems. So that should be really avoided. Okay. And one should do a graduated physical activity, number one. And number two is mental stress.
Yes.
Mental stress and anxiety can also give rise to, if it is there for a prolonged period of time, it can get into developing high blood pressure, uncontrolled, all the metabolism of the body, and also sometimes precipitate a heart problem.
Okay, so it's very...
So that can be controlled by, it's very simple. We don't need medicines for that most of the times.
Yeah.
Basically controlling the lifestyle, getting good sleep, getting, to relax, because many times people don't relax. They are just driven and keep doing things on day in and day out. That should be, controlled. Interaction with family, interaction with friends, and of course doing activities like yoga and meditation also helps in reducing mental stress.
Absolutely. I think it's managing both physical as well as mental well-being. Dr. Hiremat, exercise we know is good for everyone. It's especially important if you have a lifestyle disorder. But people with heart disease are confused about the exercises they really should be doing. So which exercises are effective and safe for people with heart disease? What do you recommend?
It has to be personalized. I'm sure the doctor or the cardiologist would advise. But broadly, we can divide them into people who have low pumping capacity of the heart. The technical word is left ventricular ejection fraction, or LVEF. If it is more than 45%, then that person is like any other person and can take up most of the activities. But person who have ejection fraction which is less than 40% have to go on a moderate kind of an exercise. And one good way out of it is to do 100 seconds on your legs every 1 hour. If they keep doing it during the day, pace around, walk around in the house, do standing jobs, then that also can be a good exercise. Okay. But by and large, we need about 150 minutes of activity per week, that is 5 sessions of 30 minutes. They can be intense based on the patient's left ventricular ejection fraction. Okay. If that is managed, then most of the time there are good results related to that.
Okay.
Sure. And we must remember that keeping active in patients, even who are sick, keeping active is more important, and not getting tired is also equally important.
So yeah, I think that, the way you put it, 150 minutes a week, that's an easy way to remember and is doable. Dr. Reddy, after speaking about exercise, mental health, physical health, tell us about diet. Should one switch to a low-carb diet to help, keep your heart healthy?
Yeah. So it has been studied, low-carb diet, reducing body sugar levels.
Okay.
Mainly, the glycemic control becomes far better with the low-carb diet. And also, it changes lipid profile of patients quite favorably for heart to reduce heart disease and the heart ailments. And also, low carb diet has been shown very effective in treating obese patients, reducing their body mass index.
Okay.
So since it reduces body mass index, makes glycemic control better, and also changes lipid profile quite favorably, it is quite effective in reducing cardiovascular events.
Okay.
Having said that, I should also mention the clinical trials which studied low-carb diet showed all these benefits. But anyway, they have not shown a huge modality or benefit, in a long term.
Okay.
Yeah, but definitely it is useful in some set of patients.
Okay. And like I think all of you said, it's about personalizing, whether it's the exercise, whether it's the diet, it's basically taking care. Holistic well-being, I think, is important here. Thank you all so much, doctors, for joining us today on this very special show. News will continue on the other side after this short break.